In the United States today, we are facing a profound health crisis, one that is quietly unfolding in our kitchens, our grocery stores, and even our doctors' offices. This isn't a single disease, but a complex web of interconnected problems. On one side, we have a food system dominated by fast food chains and highly processed products that are engineered to be irresistible, but are often stripped of nutrition and loaded with unhealthy fats, sugars, and salt. These foods are a primary driver of the chronic diseases that now affect a majority of American adults. They are convenient, they are heavily marketed, and they are making us sick in record numbers, contributing directly to conditions like obesity and type 2 diabetes. Simultaneously, we have a healthcare system that has become incredibly skilled at treating the symptoms of these diseases, but often fails to address their root causes. When someone suffers a heart attack, our medical professionals are there with advanced procedures and medications to manage the immediate crisis. However, the system is less equipped to prevent that heart attack from happening in the first place by tackling the dietary and lifestyle factors that led to it. We are caught in a reactive cycle, spending trillions of dollars to manage illnesses that are largely preventable. And this approach places an immense strain on our national resources and on the individuals who are suffering. This cycle begins with what we eat. Consider the typical American diet. For many, it involves frequent trips to fast food restaurants like McDonald's or Burger King, where meals are designed for speed and taste, not for long-term health. These meals are high in calories, but low in essential nutrients, leading to weight gain and inflammation. Beyond the drive-thru, our supermarket shelves are filled with packaged foods that promise convenience, but often contain a long list of additives, preservatives, and refined ingredients. These products contribute to a steady decline in our collective health, making it harder for families to make nutritious choices. The consequences of this diet are stark and well documented. Heart disease remains the #1 killer in the United States, and much of it is directly linked to the food we consume. Obesity rates, especially among children, have skyrocketed over the past few decades, setting up the next generation for a lifetime of health challenges. The problem is not just about individual choices. It is about an environment where the unhealthy option is often the easiest, cheapest, and most accessible one. Our food industry and healthcare system are two sides of the same coin, one creating the problem and the other struggling to manage its devastating aftermath. Beyond the visible problems of fat, sugar, and salt, a more insidious threat is contaminating our food supply: industrial chemicals. Two of the most concerning are per- and polyfluoroalkyl substances, PFAS, and microplastics. PFAS are often called forever chemicals because they do not break down in the environment or in our bodies. They are used to make products resistant to grease, water, and stains, which is why they are commonly found in fast food wrappers, pizza boxes, and non-stick cookware. When these chemicals are used in food packaging, they can easily migrate from the wrapper into the food we are about to eat, starting a journey into our bodies. These forever chemicals don't just come from packaging. They have contaminated our soil and water systems on a massive scale. This means they are absorbed by the crops we grow and consumed by the livestock we raise. As a result, PFAS have been found in a wide range of foods, including eggs, meat, and dairy products. Because they accumulate in living organisms, the concentration can become higher as you move up the food chain. This means regular dietary exposure is now a primary way these toxic substances enter our bodies, where they can build up over time and contribute to a host of serious health problems. At the same time, our world is saturated with microplastics, which are tiny plastic particles less than 5 millimeters in size. These particles come from the breakdown of larger plastic items, like bottles and bags, and they have now been found in every corner of the planet, from the deepest oceans to the highest mountains. They are in the air we breathe, the water we drink, and increasingly the food we eat. Scientists have discovered microplastics in seafood, honey, salt, and even fresh fruits and vegetables. The average person may be ingesting a credit card's worth of plastic every single week without even knowing it. The health implications of consuming these tiny plastic fragments are just beginning to be understood, and the findings are alarming. Recent studies from 2024 have shown a clear link between the presence of microplastics in our bodies and severe health risks. Researchers have found them in human blood, lungs, and even in the placentas of pregnant women. with some studies suggesting a connection to premature births. Another landmark study linked microplastic exposure to a dramatically increased risk of heart attack, stroke, and death. Like PFAS, these particles are invisible invaders that our modern, convenience-driven lifestyle has introduced onto our plates. The combined impact of poor nutrition and chemical contamination is fueling an epidemic of chronic disease that is overwhelming our healthcare system and our economy. Conditions like heart disease, obesity, certain cancers, and diabetes are not just personal tragedies. They represent a staggering financial burden on the nation. We spend hundreds of billions of dollars every year on medical treatments, prescription drugs, and hospital stays for illnesses that could largely be prevented by addressing their environmental and dietary roots. This is money that could otherwise be invested in education, infrastructure, or innovation. But instead, it is spent managing the consequences of our unhealthy environment. This system creates a vicious cycle. The food and consumer product industries profit from selling cheap, convenient, but unhealthy products. As people consume these goods, their health declines, leading them into the arms of a healthcare system that profits from treating chronic conditions with expensive, long-term interventions. The focus remains on managing symptoms, prescribing medication for high blood pressure or performing surgery on clogged arteries, rather than on preventing the disease in the first place. The result is a population that is sicker than ever, despite spending more on healthcare per capita than any other country in the world. For individuals and families, the toll is immense. A diagnosis of a chronic disease can mean a lifetime of medical appointments, expensive medications with difficult side effects, and a diminished quality of life. It can lead to lost wages from being too sick to work and can plunge families into medical debt. The stress and hardship extend beyond the patient, affecting entire families who must act as caregivers. Life becomes a balancing act of managing illness, navigating a complex healthcare system, and trying to afford the cost of care. This is the human price we pay for a system that prioritizes profits over public health. The scientific evidence connecting our modern lifestyle to this crisis is undeniable. A recent index from the Public Health Institute in early 2025 rated popular fast food chains and even entertainment services like Netflix on their health impact, and most scored negatively for promoting sedentary behavior and unhealthy eating. The chemicals are just as damaging. Studies have directly linked PFAS exposure to immune system problems, liver disease, and an increased risk of cancer. The rising tide of chronic illness is not a mystery. It is a predictable outcome of an environment saturated with unhealthy products and toxic substances. Reversing this crisis requires a coordinated effort from all sectors of society. We can no longer afford to treat these problems in isolation. First, corporations in the food and consumer goods industries must be held accountable for the health impacts of their products. This means redesigning foods to be lower in sugar, unhealthy fats, and sodium, and phasing out the use of toxic chemicals like PFAS in packaging and cookware. Companies should be incentivized to create products that support health rather than undermine it. Transparency is key, so consumers need clear labeling that allows them to make informed choices about what they are buying and eating. The government also has a critical role to play through stronger regulation and public health initiatives. We need to expand on recent actions, like the EPA's new limits on PFAS in drinking water, by establishing strict regulations for these chemicals in our food supply. Similarly, policies should be implemented to reduce microplastic pollution at its source. The government can also support public health by making healthy foods more affordable and accessible, especially in underserved communities, and by funding education campaigns that clearly explain the risks of processed foods and environmental contaminants, empowering people with knowledge. As individuals, we also have power. We can start by making conscious choices to eat more whole foods, like fruits, vegetables, and lean proteins, while reducing our reliance on fast food and heavily processed products. Reading labels and choosing products with simpler, recognizable ingredients can make a significant difference. We can also reduce our exposure to chemicals by avoiding non-stick cookware and minimizing our use of single-use plastics. By voting with our dollars, we can send a powerful message to companies that there is a growing demand for healthier, safer products for our families. Ultimately, creating a healthier future requires a fundamental shift in our mindset. We must move from a system that profits from sickness to one that invests in wellness. This means prioritizing prevention, promoting health literacy, and demanding accountability from the industries that shape our environment. It is a monumental task, but it is not impossible. By working together, companies innovating for health, governments regulating for safety, and individuals choosing for well-being, we can break the cycle of chronic disease and build a nation where everyone has the opportunity to live a long, healthy, and productive life.